Tonight at 6, we talk to a licensed medical doctor who says he's currently treating patients with symptoms of toxic exposure that he believes are caused by the BP oil spill. He's waiting on blood test results of patients who work in the Vessels of Opportunity program who were exposed to high levels of hazardous chemicals. But as News Channel 7's Megan O'Halloran tells us, they may not be the only ones at risk.
The same volatile organic compounds found in petroleum product and dispersants are also present in just about every city and state in America.
They're going to be found regardless. And up to what degree that becomes normal depends strictly on how your body can get rid of them.
Dr. Rodney Soto runs the Younger You Institute, an anti-aging clinic in Santa Rosa Beach. He is a licensed medical doctor who specializes in preventative care. Soto says he's seeing more patients who are testing positive for toxic agents associated with the oil spill in excess of the 95th percentile.
Initial reports had said that the oil was not toxic, that the carcinogens and the toxins evaporated with the weathered oil, and that's what was being told to the public. Is that something you agree with?
Not necessarily. Remember that these are volatile compounds. They do evaporate, but where do they evaporate? They evaporate in the atmosphere, and they mix with other gases, and they dump back down on the lands through the rain. They remain in the air too, and that's what we cannot safely say, well, we're okay now. These are very dangerous compounds.
If they're spreading beyond the shoreline, could we all be at risk?
If you add to that environmental load that we have, the system becomes overwhelmed. The liver, up to some degree can take care of some of that, of course, but when you get a huge load of toxins and chemicals, then the system gets overwhelmed, and then it can't take care of it, and where's it going to go? Stay in the tissues, affecting their functions, brain function, immune system, hormonal function, and affects the overall aging process in general, but most importantly, the risk that people's going to have of significant diseases in the future.
Nobody really knows the long-term health effects of the largest oil spill in our nation's history, but a simple blood test can detect your volatile solvent levels, a procedure Dr. Soto now finds himself doing quite often these days.
And now a lot of skeptics may say that you might be using scare tactics to bring in more business.
Well, I'm sure they can, and they have been said that before. I do this for anybody who would like to be tested. I don't want to advertise that in any way to promote, to increase business. It's a decision of their own. I don't force anybody to come. They have their free choice, and it's a matter of who they want to see for it. They can all see their own primary care doctor too, and say, doctor, can you test me for it? And primary care doctors can do that.
In Santa Rosa Beach, Megan O'Halloran, News Channel 7.
We haven't heard too much about people suffering illnesses related to the BP oil spill, but a local doctor says he's seeing more and more patients with symptoms of toxic exposure to petroleum product and chemical dispersants. News Channel 7's Megan O'Halloran details some of what he's seen so far.
But what else was washing up with the tar balls? Dr. Rodney Soto, a licensed medical doctor, says the effects of organic volatile compounds found in petroleum product and chemical dispersants contain toxic material. He's already treating patients with symptoms of exposure.
I'm not talking about just the short-term effects of irritation in the airways or headaches or rashes, people being experienced from symptoms that we get called here in the office or they come to see me because of those. But I'm more concerned about the long-term health effects that nobody talks about it, nobody is even thinking of, that 5, 10, 15, 20 years from now, we're going to see, cancer.